everybody, I'm Aileen. I'm a registered physiotherapist and Pilates instructor, and welcome to Staystrongonline. Today I'm just going to do a couple of exercises, a few breathing exercises, shoulder mobility, and opening up that chest wall. So if you can follow along with me, that is great. If you have a mat or a towel, get down on the floor. If you can't get on the floor, you could do these exercises in your bed. So let's get started. I like using a pillow to prop myself up, and a lot of my patients do as well. So if you have a pillow or a cushion and you feel comfortable, have a seat, okay? So just to get started, we're gonna do some breathing, but before we breathe, I don't want this slumped posture when we're fatigued. I want you to pull up. Bring your ribs in, so don't pop your ribs out. Sometimes when people say pull up, they automatically pop their chest. So ribs are connected to your hip bones. The spine is long, the shoulders are down. We're gonna take a couple of deep breaths. Put your hands, if you can, on the sides of the lower sides of your ribs. And that's where I want you to fill in, almost like an accordion. So take a deep breath. Inhale and exhale. Feel that tightening. And again, inhale and exhale. Two more times. Inhale and exhale. One more time. Inhale and exhale. Great. Hands by your side. As we inhale, we elevate our shoulders. Inhale. Exhale, we roll them back. Inhale up. Exhale, roll back. Inhale up. Exhale, roll back. One more time. Inhale. And exhale, roll back. Now let's roll them forward, but don't contract forward, right? So you start, roll them up and forward. Keep your breath going. Keep long in the spine. Feel that your tummy is also engaged, that you're not collapsing through your diaphragm or your abdominals. That's it. One more time and around. Excellent. Put your hand over top of your sternum. This time you're going to take a deep breath. Lift those elbows, and as you exhale, just press down a little bit on the sternum. So this time, inhale, exhale, press down on the sternum. Two more times. Inhale and exhale. Once more, inhale and exhale. This time as you inhale, and when you exhale, turn your head to the side and give a little pressure down. So you get some neck rotation. Inhale and exhale. Feel the air going right through your whole body. And exhale. Last time, inhale and exhale. Hands by the side. We're going to elevate our left hand and go into side flexion. I'm your mirror image. If you can't elevate your hand over your shoulder, you can keep your hand right on your shoulder or behind your head. But if you can try, do so, all right? So we take and elevate that arm. Again, we're pulled up in the ribs, and we side flex over. Keep that shoulder down. Don't contract, and don't contract this way. Nice elongation. Feel the stretch there, and take a deep breath to fill that up. Exhale, come back. Slowly float the other arm up. Side bend. Let the head drop, let the shoulder drop, and reach just that inch more. Take a deep breath and come back. Over again. Let's do this a few times. This feels so good. Over to the side. Deep breath in and exhale. Pull the belly in when you come back. Over again. Good. Deep breath and exhale. Come back. Inhale over and exhale. Inhale back, don't collapse. It's straight side flexion, making sure the other shoulder is down, the neck is long, a lot of air entry going through. Once more on this side, good. And on the other side. Excellent. Okay, next we're going to put the hand behind the head and we're going to add to this exercise. Again, if you can't get it behind your head, put it on your shoulder. So hand behind your head, left hand up, other hand down. Side flex over to where you're comfortable. So for me, that elbow is pointing almost directly to the ceiling. Then I want you to rotate, point the elbow down to the floor, point it back up to the ceiling, and come back. Hand behind the head, side flex over, elbow pointing down, elbow point up, and come back to your starting. Side flex over. Remember, keep that shoulder down. Bend down. Feel the stretch. Back, over, side flex, down, back, and over. This time we're going to go side flex, down, and I want you to hold it there and breathe in that position. 2 breaths. And out. Inhale. And out. One more inhale. And then back to center. Same thing on the other side. Side flex over. Elbow down. Take 2 breaths. Inhale. Exhale. Try to get that oxygen down in the lower lungs. Inhale and exhale. One more time. Inhale and then coming back up. Excellent work. All right, so I'm going to have you lie down next. And we're just going to do some easy shoulder mobility. So you have to continue to do this. Keep yourself open and do whatever you can. Now, some of my patients who come to see me have a bit of this rounded head, protective posture, head forward, rounded thoracic, head forward. If they lie down, or if you're like this and you lie down, you get into this position and your head goes like this. This is not comfortable at all. So what I suggest you do, grab a pillow or wherever you are comfortable, put it behind your head. Knees bent, feet planted nicely on the ground, ribs down, hips down. And you want this triangular position from your pubic bone to your hip bone to be in the same plane, not tilted up, not tilted down, just in the nice same plane. Hands by your side. Nice air entry in through your throat. Elevate the arms up to where you can and down. Great. And up. Good. And down. Now we're going to lift them up. Turn our palms. Bring them as far back as you can without popping the ribs. Back, over the shoulders, and down. So lift up, rotate, over your head, back and down, lift up, rotate, over your head, back and down. Keep a length in the spine, rotate, back, keep those ribs down. Again, lift up, rotate, back and down. Now I have a tendency to pop, so I want to really keep engaged here. Next and last exercise for this little segment, lying on your side. For this, get another pillow, or make sure you have a couple of pillows. Not necessarily this big, but this is what I've had downstairs. Put the pillow between your knees. For women with our hips, we tend to collapse there. So if I didn't have the pillow, this was where I would be. We don't want that. We want nice pelvic stability. And when you're in this position, feel as if there's a little bit of a gap under your waist. So you're not collapsing. You've got that little bit of weight, a little bit of air entry, I guess, or a little mouth sometimes. Hand in front of the sternum. Reach forward to protract. Reach back to retract. So we're just getting a little bit of this shoulder moving. 2, 3. Keep reaching back. 4 and 5. Now this time, make sure those legs are 90-90. Lift the arm up. Follow it with your eyes. And bring it down. So inhale. And exhale. Inhale. And exhale. 2 more. Inhale. And exhale. Now the next chest opener, we're going to take it past this perpendicular, opening it all up. Follow your eyes to the back. Take a big inhale there. Exhale, bring it back to close it. So inhale to open it up. Exhale, squeeze the pillow and come back. So as you squeeze the pillow, you get a little bit more engagement in your abdominals. Exhale and squeeze. You should feel that. One more time. Inhale and exhale and squeeze. Full circle. Again, hand here if you cannot do the full range. Do what you can. Lifting the arm up, rotate onto your back, sweep the arm around. And again, inhale, stretch, exhale, sweep. Inhale, go at your own pace. And this feels so good. One more time. Inhale. Good. And exhale. And let's reverse that. So opening up at the back. Reaching over top. And forward towards me. And opening up. Over top. And forward, opening up, over top, and forward. And if you notice, my head follows my arms. My eyes do as well. Last time on this side, and open, and around. Great. So I'm going to go on the other side. If you have unilateral or one-sided breast cancer, you're not bilateral, you may want to do the exercise twice on the same side, on the affected side, because that is the tight side and we need to open it up. And that tightness is not just in this quadrant, it affects your whole body. So lying down again, we're going to start with protraction, retraction, pillow between the legs. Sometimes if you have a ball or a roller, this is a good exercise to do. So just reaching forward and retract back and reach forward and retract back. You can slide that hand along the floor or the carpet. I don't know if you'll find any dust there. I'll probably find a few little dog hairs. And forward and back. Great. Opening up 4 times to the ceiling, lifting up and back. So our breath is inhale, exhale, inhale, exhale. This is the 4th one. Inhale, exhale. Now opening up that chest wall. Keep that pillow engaged. That protects your back. Inhale, exhale, squeeze the pillow, engage those muscles. Inhale, open up, reach right through those fingertips, and exhale, coming back. So not sloppy arms. I want to see that energy go right through the ends, almost as if you had a laser beam and you're reaching to the other side of the wall. And you're reaching past. That will give you that stretch. One more time. Inhale. Good. And exhale. Circular motions next. Reach over top. Good. Open the chest and around. So we inhale as we reach and open, and we exhale as we close. Inhale, reach, and exhale, close. Inhale, reach, and exhale, close. Going the other direction. Sweep it as far as you can, and again, lengthen. Okay, so we want to get out and stretch all the tissues, all the fascia, all the muscles. You don't want to be in this contracted position. We want to be elongated, long muscles, good air entry. All this will help you right through your whole day. So we want to fill up that oxygen. One more time. And let's make the last one the best one. So stretch, reach, 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 reach. Feel that stretch in the fascia and come back. Excellent. Okay, so that was today's little session. We will be giving you more videos, so hopefully you can use this and this can help you. Do whatever you can. If you can do the whole segment, great. If you can only do a few exercises, that's great too. So take care, stay strong, and we'll see you next time. Bye for now.